RWJBarnabas Health is an award-winning healthcare system full of incredibly talented and diverse people, like you. Nearly 50,000 employees, physicians, residents, and interns are part of the RWJBH family at locations throughout New Jersey. We are honored to have you join the incredible team. Perhaps you're an IT professional or surgeon, or you'll be joining environmental services or EMS crew. Or maybe you'll become one of our many invaluable transporters, dietary service workers, nurses, or security officers. The list goes on, and wherever you fit in, we're proud to attract and retain the best of the best. Hard workers doing hard work. Each day at our hospitals, hundreds of patients are entrusted to our care, your care. Whether your work involves providing direct care to patients or supporting those who provide patient care, it's a responsibility that we all take seriously. For many of us, it's the reason we chose a career in healthcare. This is why we are committed to a culture we call Safety Together, as we continue our commitment to prioritizing RWJBH's high reliability journey toward zero incidents of preventable harm. What is harm in healthcare? Well, it can be emotional or physical harm, and the unfortunate reality is that it can also be fatal. It happens all over the world, and it happens here at RWJBH too. And it is preventable. It also happens way more than most people could imagine. How big of a problem is it? I hope you're sitting down, because what you're about to hear is going to be pretty stunning. In 1999, the Institute of Medicine put out a report stating that there are up to an estimated 98,000 deaths each year as the result of medical mistakes and errors. Let's try and make that more mentally manageable. 98,000 would be the equivalent of a 747 airplane full of people crashing every single day, with everyone on board perishing. Would you plan a trip on an airplane if you knew that was an actual statistic? Probably not. But we don't have that choice in receiving health care. It gets worse. Other estimates have the number of estimated deaths closer to 400,000. The British Medical Journal came out with a study in 2016 that said if medical error were used as a cause of death, it would be the third leading cause of death in the U.S., behind cancer and heart disease. Cancer and heart disease is not good company to be in. And these aren't faceless, nameless numbers and statistics. They're not just patients or a diagnosis to us. They're people. They're someone's loved one, someone's friend. And that is why we all have to work really hard, together, to prevent harm. We've committed to zero harm since 2017 and have already seen the results. We went from 1,120 events in 2017 to less than 900 in 2020, which is why we're here today. Because the good news is that together, we can, and have already, helped to reduce those devastating numbers. But we need your help. Yes, you. Healthcare is an industry where people work very hard performing complex, high-risk activities that unfortunately can result in preventable harm to patients and themselves. And far too often, they do. Hi, Youssef.
Oh, hello, Emily. Have I got a life-changing story for you? When I was working at Duke University, back in February of 2003, a 17-year-old named Jessica was waiting for a heart and lung transplant to be performed by Dr. Jaggers, a surgeon who had done more than 100 successful heart transplants and was world-renowned for pediatric transplants. Carolina Donor Services called Dr. Jaggers to say they had found a donor for another one of his patients, but Dr. Jaggers said he couldn't use the organs for that patient, but asked if the heart and lungs would be appropriate for Jessica. He was told he could have the organs. Carolina Donor Services had firm policies in place requiring that blood types be matched before releasing any organs. Yet in this case, a number of the checks in those policies had been missed. Another member of the transplant team who picked up the donor organs was informed of the donor's blood type at least 3 times, But he had never been told Jessica's blood type, so he didn't know the organs were a mismatch, and the surgery was scheduled. Dr. Jaggers said that everything in the operation went smoothly until 5 hours in when he got a call from a technician in the immunology lab saying something was terribly wrong. Jessica's blood type did not match the blood type of her new organs, but they'd already done the transplant. A couple weeks after the operation, Jessica received a second transplant, but it was too late to save her life.
Gosh, that's so sad. Everybody makes errors, even the best and brightest.
Oh, absolutely. 12 people had an opportunity to intervene and prevent this error. 7 checks were supposed to have been done on a regular basis. Only 2 were actually conducted.
Wow, how tragic. A young life lost, and team members who had to live with the impact of an overly complex system that failed.
Hey, Emily.
Hello, Fukashi.
I've got a story that sounds totally unbelievable, but is 100% true. This story helped show me how patient safety isn't limited to the clinical environment. I'm not a doctor or a dietary worker. Safety really is everybody's business. And that's why you're all going through this training together. In the fall of 2004, maintenance workers from Automatic Elevator, a firm that services hospitals' elevators, drained hydraulic fluid from elevators into containers that had previously held surgical detergent, but the containers were not properly relabeled or securely stored. Then, Cardinal Health, the firm that provides surgical detergent to the Duke Health system, picked the containers up, which appeared to be full containers, restocked, and then shipped them out as detergent back to several hospitals, where it was then used in the cleaning process for surgical instruments at 2 Duke hospitals. By the time the error was discovered, over 3,800 patients had been affected. Surgeons were apparently saying things like, the instruments seemed to be a little more slick, and the staff in sterile processing were saying, the soap looked a little darker and smelled a little different. Yet no one took the next step and asked why. Nobody had a good questioning attitude or felt empowered enough to stop the line when something didn't seem right.
Yeah, no matter what your role is here at RWJBH, you may very well be faced with an opportunity to step up and ask the question or take the action needed to best care for and support our patients and each other. If something isn't right or just doesn't seem right, that's when we need you to make it right by calling it out. It's what we all need to do if we're going to reach zero harm. We should think of it as our moral obligation to our patients and fellow staff members.
Clinical or non-clinical staff. We never know how our actions or lack of actions may affect the safety of our patients and each other.
Safety, inclusivity, and excellence are literally everybody's responsibility. One cool thing is that instead of keeping the secret, hospitals now know the value of sharing lessons and learning from each other. So those 2 incidents at Duke were shared so others could learn from them, and we fully support that decision. Transparency is not only necessary, it's expected. Errors will never completely go away, but the harm caused by errors can, when we commit to safety together. When we are open to constructively challenging others and being challenged ourselves. Of course, the safety of patients and employees has always been a priority. Safety together is about sharpening our focus so that a culture of safety is at our core, and you can feel it as a team member or a patient or a family member in every interaction at RWJBH. We have adopted and are ingraining these shared values and beliefs about how we act and interact so that we can make our organization an even better place for patients and employees, with fewer human errors and fewer events of harm. So, that's why we're here today. That's why we're spending so much time, energy, and resources on this. Because of the people and families we've unfortunately harmed, we have prevented many errors and harm events throughout our organization, but even one would be too many. None of the preventable harm occurrences at RWJBarnabas Health are a result of caregivers with bad motives, nor are they a result of us being a bad healthcare system. It is part of the complexity of the care we provide and all of the individual and systemic reasons why errors exist. That is why we are here today. to learn how we can do all we can to eliminate these events, to get to zero harm.